Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. Can AI detect cancerous brain tumor in 10 seconds? Researchers have developed an AI-powered model that in 10 seconds can determine during surgery if any part of a cancerous brain tumor that could be removed remains, a study published in Nature suggests. The technology called flash glioma outperformed conventional methods for identifying what remains of a tumor by a wide margin, according to the research team led by University of Michigan and University of California, San Francisco. When a neurosurgeon removes a life-threatening tumor from a patient's brain, they are rarely able to remove the entire mass. Neurosurgical teams employ different methods to locate the residual tumor during a procedure. They may get MRI imaging, which requires intraoperative machinery that is not available everywhere. The surgeon might also use a fluorescent imaging agent to identify tumor tissues, which is not applicable for all tumor types. Neuropathic pain medication may increase risk of hip fracture. Gabapentinoid use was associated with an increased risk of hip fractures, especially in patients who were frail or had chronic kidney disease, according to a study published in JAMA Network. The researchers tracked patients hospitalized for hip fractures in Victoria, Australia from March 2013 through June 2018 who had used gabapentinoids before the injury. Study co-author and director of the Center of Medicine Use and Safety at the Monash Institute of Pharmaceutical Sciences, Professor Simon Bell, said gabapentinoids can be effective for neuropathic pain but can also result in adverse events including dizziness, gait disturbance, and balance disorder. The researchers analyzed the data for 28,293 patients who experienced hip fractures across a 5-year period. How embracing social media mindfully can lower stress. Young people's mental health may depend on how they use social media rather than how much time they spend during it, according to a new study by University of BC researchers. The research published in the Journal of Experimental Psychology journal examined the effects of quitting social media versus using it more intentionally. The results showed that users who thoughtfully managed their online interactions as well as those who abstained from social media entirely saw mental health benefits, particularly in reducing symptoms of anxiety, depression, and loneliness. With social media use nearly universal among young adults, especially those ages 17 to 29, concerns over its impact on mental health have grown. In the 6-week study, 393 Canadian young adults with some mental health symptoms and concern about social media's impact on their mental health were split into 3 groups. A control group that continued their usual routines, an abstinence group asked to stop using social media entirely, a tutorial group that was coached in intentional usage. Plastic waste to double by 2050, but study finds blueprint to tackle plastic crisis. Without intervention, global plastic waste could double by 2050, a new machine learning study predicts. However, according to simulations by the study's author, a mix of policy interventions could cut plastic waste by more than 90% and it could cut plastic-related emissions by a third. With UN treaty negotiations underway, these findings provide a crucial blueprint for tackling the plastic crisis. Plastic production has increased relentlessly for decades, leading to surging plastic waste generation and environmental mismanagement. As plastic degrades, it fragments into micro and nanoplastics, which harm ecosystems globally, from the Arctic to deep ocean habitats, and pose significant health risks, including heightened cancer risk, cardiovascular disease, and reproductive issues. The plastic life cycle also intensifies climate change through the emission from oil and gas extraction, production, and waste processing. The disproportionate plastic waste burden on the global south and the frequency of situation plastic facilities near marginalized communities have sparked pressing environmental justice concerns. Recently, there has been global momentum to address these issues, culminating in a 2022 United Nations resolution to negotiate a legally binding treaty to curb plastic pollution. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.